Calcium carbonate, also known as Tums or Rolaids. So just knowing that, you're going to know kind of one of the things that this medication does. So generic name is calcium carbonate, trade name is Tums or Rolaids. A reason we give this is to treat hypocalcemia, prevent postmenopausal osteoporosis, treatment of hyperkalemia and hypermagnesemia, as well as used as an antacid, okay? So what does calcium do and why are we giving this? Calcium is essential for nervous and muscular and skeletal systems, helps maintain cell membranes, aids in transmission of nerve impulses and muscular contraction. It also aids in blood formation and coagulation, so it plays a role in a lot of different areas within the body. Again, one of the big things that it plays a role in is muscular contraction and transmission of nerve impulses along and within our cell membranes. So its therapeutic class is mineral and electrolyte replacement or supplement. Pharmacologic class is antacid. Okay, so again, we're giving this a lot of times. This calcium carbonate is going to be given specifically for the ulcer or for that antacid use with the Tums or the Rolaids. But as we talked about in our other medication, our calcium acetate, is we kind of talked about some of the ways that this medication is used and why we're giving it, okay? So some of the things you're going to want to keep in mind here is that it can cause cardiac arrest and arrhythmias. Remember, it plays a very important role in muscular contraction, and as we give this calcium, we're manipulating other electrolytes as well. So it's important to keep in mind that as we manipulate one electrolyte, we can manipulate other electrolytes. So we're going to mess with our potassium and our magnesium, and that can really affect cardiac arrhythms, okay? So we're going to want to monitor our hemodynamics. It can also cause hypotension, bradycardia, and again, arrhythmias. Hypercalcemia can increase the risk for digoxin toxicity. We talked about this before as well with calcium acetate. And we want to instruct our patient on foods that contain vitamin D because vitamin D plays a role in calcium absorption. And so it really is important to monitor vitamin D intake along with our calcium intake. One other thing that I want to mention here that we didn't mention in calcium acetate is we want to monitor parathyroid hormone. Okay, the reason for this is that calcium levels or parathyroid glands regulate calcium levels, okay? So we have our thyroid gland, and on our thyroid gland we have two parathyroid glands on either side of our thyroid, right? One on the top, one on the bottom on either side. So we have four parathyroid glands. And our parathyroid gland really plays a role in calcium levels, okay? So when we think calcium, we have to be thinking parathyroid as well. So it's very important to monitor parathyroid hormone and to ensure that remains within an appropriate level. And it's very important because our parathyroid gland really maintains this very tight range of our calcium electrolyte, okay? So our calcium electrolyte is really a very narrow range that it must stay within, and the parathyroid hormone really helps to regulate that and keep that within its normal functioning range. Okay, so with our calcium acetate as well as with our calcium carbonate, it's important to always be thinking parathyroid hormone. And whenever we have dysfunction with our parathyroid hormone, we're going to have dysfunction with our calcium. And so if we see calcium off or too high, too low, it's important to also be thinking about, okay, how is our parathyroid functioning? Okay, so not thyroid hormone, or not thyroid gland, but parathyroid gland, okay, which sits within your thyroid. This has been another episode of the Nursing.com MedMaster Podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.